Good afternoon. My name is Chris Romina, Lead Communications Analyst at Health Workforce Development. We're excited that you've joined us today for the Certified Wellness Coach Designated Education Program webinar. Before I begin, I'd like to go through the agenda. Today, we'll be doing housekeeping and an introduction. After that, Hovik Khosrovian, our Senior Policy Advisor, will do an introduction and welcome. From there, Ben Gamache, our Policy Analyst, will go over the Certified Wellness Coach profession as a whole. Our Irene Ornelius, our education consultant, will go over the specifics of the Designation Education Program, and then we will have a question and answer session with Ben and Irene at the end. I will close it up with some closing remarks. From there, let's do some housekeeping. This webinar is hosted in Microsoft Teams. If you're not familiar with the platform, you can find the camera, microphone, chat, and view controls in the menu bar at the top of your screens. Please raise your hand to be called on to ask a question. Camera and microphone functions are enabled today, but we do ask that you remain off camera and on mute until the questions and answer section at the end. This webinar will be recorded and will be available within 7 to 10 business days. We'll be sending a download link for you to access those. And this webinar today will focus only on the HCI Designated Education Program details, especially when it comes to the question and answer session. And with that, I am thrilled to introduce Hovik Khosrovian, Senior Policy Advisor for Workforce Development.
Good afternoon, everybody. Just want to say thank you for attending the webinar and participating. We're really excited about today. This is our first webinar on this topic for the community colleges. You'll hear quite a bit about our new profession, the wellness coach profession, which is something that creating a new profession is new to HCI and new to our Health Workforce Development Office. So really excited about sharing this with everybody and sharing the opportunities that come along with this, and really focusing on this key profession that we've created to really support the children and youth in California in behavioral health, and really help them to be able to serve the children and youth in the schools, but also to support the education programs that are going to be training these individuals. So without further ado, I wanted to introduce Ben Gamache to go over the profession itself, and we'll all chat with you later. Thanks.
Thanks, Hovik. Well, I see some very familiar names on here and soon some familiar faces, so we're really happy that you could all join us today. Many of you are probably pretty familiar with the wellness coach profession at this point, but it definitely bears to go through the information again, as well as provide you updates as they currently stand. And then, so that'll be part one. And then in part two, we'll talk about what it actually means to become a designated program and how you go through the process. So ideally, we can give you all the details and information you need to hit the ground running, should it seem like there's a good alignment with your program and HCI. So our mission as HCI is to expand equitable access to quality, affordable healthcare for all Californians. So we, again, are really focusing on the aspect of a health workforce that can accomplish that through the Certified Wellness Coach profession. And our approach, on the next slide, is that, again, as we mentioned, should have access to equitable, affordable, quality healthcare by a diverse workforce. So that is really a key aspect, and why partnering with our community colleges is such an essential aspect to this profession, is because we really do see community colleges as a wonderful entry point into higher education. And they have a span and a reach throughout the state, so we can really try and get a representative workforce through the wellness coach. Next slide, please. So in the Office of Health Workforce Development, which is our office, we have had two different segments that we tend to prioritize. One is the development, support, and expansion of a health workforce that serves medically underserved areas, represents the California it serves through racial and language diversity, and serves Medi-Cal members. We also offer financial support. That's been the wide breadth of what HCI offers is educational capacity, scholarship and loan repayment programs, and organizations to build the workforce pipeline. So we are more in that first section right now, where we're, again, looking to expand a health workforce, and we'll talk about a little bit more in this profession that is this kind of primary prevention, early intervention behavioral health specialist. Next slide. So the Certified Wellness Coach came from the Children and Youth Behavioral Health Initiative, which is part of the Master Plan for Kids' Mental Health. That was a historic investment that came from the state of California that's really looking at a whole child approach, and the focus being mental health and well-being of our children and youth. And as part of that larger initiative of CYBHI, HCI received almost $340 million to design and build the Certified Wellness Coach profession. For some of you that were along this journey very early on, or if you've looked at the statute of CYBHI, it is referred to as behavioral health coach, or just behavioral health generally. We did change it to Certified Wellness Coach as part of our stakeholder engagement process and a way to really engage with our youth and families in a more tangible and accessible way. So it's going back to that access as a key point of HCI's mission. Next slide. So we always like to start with, why are we creating this? What is the problem that the Certified Wellness Coach address? And right now, it's children and youth have inadequate and inequitable access to the behavioral health care they need. Of course, that's a big problem. The wellness coach is not going to be able to solve that problem on its own, but that is kind of an overarching framework that we always keep in mind as we think, when we're creating these aspects of this program, of this profession, how are we doing what we can to try and support more adequate and more equitable access to behavioral health care for our children and youth in the state of California. Next slide. So with that in mind, we now understand the problem. So the vision and purpose of our wellness coach is to improve the behavioral health and well-being of children and youth through age 25. So this is the Children and Youth Behavioral Health Initiative. So this spans the entire range of, can even call them young adults, up to 25, by creating a new provider type. And they will support children's social and emotional development and provide appropriate referral services and settings that reach all children. Next slide. This role is designed to increase the overall capacity for delivering behavioral health services to children and youth. We want to meet children and youth where they are. And as I mentioned, this is all the way through age 25. As was also mentioned in previous slides, this is all about a behavioral health workforce that represents the diversity of California's children and youth. So really looking at how we can recruit, promote, attract candidates that represent the wide range of diversity that California has as part of its population. We are looking to fill some of the workforce gaps that exist today. Again, we'll talk a little bit about that more and why the Wellness Coach 1 profession, which we're focusing on, is that associate's level degree requirement, and that there are not many opportunities at that level. So this is meant to fill in some of those entry-level behavioral health providers into the workforce today. But at the same time, we want to ensure that it's not only a desirable occupation, but they have the foundation to advance into more, into higher level degrees and more advanced professions if they want to go on to licensure, head into clinical settings, that they have the foundation from an entry level higher ed to be able to transfer up to 4-year programs or even into masters and above. And so we'll talk about that in our future slides as well. So there's a lot of information here on this theory of change, but this is essentially the model that kind of guides our activities and really leads us with a framework towards what are our overall outcomes that we're trying to achieve. So we're going to actually work from right to left here with, again, going back to what is our broader vision, what is our ultimate downstream outcomes that we're trying to march towards, what are our early outcomes that we want to accomplish in the near term, and what are the activities that we're going to be doing to get towards those. So as I mentioned, we are trying to improve the overall mental health and well-being for California's children and youth. And with doing so, we're really focusing on our underserved communities and making sure that there's appropriate and effective behavioral health support and services. And again, that's where that representative aspect comes from, because we want to make sure that they are effective, and we understand that there has to be a wide variety of individuals so that our children and youth feel seen, they feel supported, they feel that there's a sense of safety and trust in those individuals. But to do that, we need to make sure that there's a sufficient and diverse workforce of community health, certified wellness coaches. And again, their focus, as I mentioned, is in the primary prevention and early intervention space. And so in order to get a sufficient and diverse CWC workforce, we have to create a supply first and foremost. And we're doing that by HCI being the certifying entity that actually is going to get wellness coach applicants certified and into the workforce. And we also need to create a demand, ensuring that they have placement, ensuring that there is actually an opportunity for them to be employed once they are certified. So we are balancing that supply and demand. A lot of our focus right now is on the public education system. So connecting widely statewide with our county office of ed, our LEAs and school districts, as well as community-based organizations that are school linked and school affiliated, because that's where we see getting in front of the most children where they are, is, at their education. And so there are some things that we're doing to actually support that right now. We have a comprehensive marketing campaign and stakeholder outreach. We just launched our employer support grant that is currently open and active for about another month, that is providing funding to our employers, focusing again on our education communities so that they actually have funding to be able to hire on wellness coaches. And this is meant to be bridge funding in this year while wellness coaches go through the state plan amendment through DHCS with the Department of Healthcare Services to become a new provider type and be added to something that's called the multi-payer fee schedule. We won't talk about that much during this one, but just it's a structure essentially to be able to start having services such as these preventative and early interventive services be reimbursed in the school setting, both through Medi-Cal and commercial insurance. So that's really revolutionary and is a sustainable funding mechanism to ensure that this new workforce ideally can find employment and retain employment, and our employers have less burden in being able to actually keep these individuals on. Also to call out, our community colleges can be potential employers. So there is not only an opportunity to be education programs, but also employers, because again, they're serving children and youth up to age 25. There are wellness centers on campus. There are lots of opportunities for wellness coaches to be able to provide that transition age youth as well. So that's our demand side. And on our supply side is really our focus. Right now, the number one that we're focusing on is that top box, which is partner with and fund California colleges and universities to create education programs at the associate's level and bachelor's level, and then do whatever we can to attract diverse candidates to go through those programs. We are also going to be offering student scholarships to support students going through that, reduce those barriers, because we know that, of course, income and funding is a barrier. So we want to do whatever we can to provide scholarships with a service obligation to ensure, again, that they are actually going into the field and supporting the capacity need. And then, as we also mentioned previously, we are launching our certification. So wellness coaches actually can begin certifying tomorrow. So that is being launched. That is for those, and we can talk about it later, but don't really want to address that. But that's for kind of our short term, those that are already pre-qualified with degrees we've identified already align. So those are those that are recent graduates, as well as those that are currently enrolled. And then we also have a workforce pathway. But that's another conversation. If we can talk about that if anybody has questions at another time. So that's kind of the big high-level approach of what we're trying to do. But now what we're really focusing on, again, is our education programs and why we're all here today, which is developing out and becoming an HCI designated wellness coach program, specifically to train and educate our applicants for Certified Wellness Coach 1 profession. Next slide, please. So great, what are our wellness coaches actually going to do in the primary prevention and early intervention space? Many of you have probably seen this before, but they're really going to focus on those 6 core services there of wellness promotion, education, screening, care coordination, extension, individual and group support, and crisis referral. So again, this is what we want them to be able to do upon entry into the workforce. And we also want to make sure that they have the competencies to do that and do it effectively and accessibly to be able to really support our children and youth. And so cultural responsiveness, humility, and the ability to mitigate implicit bias is a big aspect of this. Of course, professionalism, ethics, and legal mandates, strong communication skills, the ability to reflect, connect, empathize, and then the ability to operate in their role in different environments. So making sure that they have the foundation to be able to adapt and be placed in any setting that can support a child or youth. Understanding that additional trainings or specializations will require additional trainings, of course, as is typical with most professions once they're actually into the workforce and out of their education program. Next slide. So this is just an illustrative example of the behavioral health career lattice and kind of just wanting to show, okay, great, where do our wellness coaches fit in? The Certified Wellness Coach 1, again, is the associates level, and that's where we see them fitting in. And again, just another employment opportunity at the associates level where there are not a lot as it currently stands. Next slide. So who can enter into education programs? You're all very familiar with this. Anybody can enter into education programs. It can be those that are currently working in schools and already have been working with children and youth, those that are already currently working in healthcare, behavioral health, those that are recent high school graduates, people in unrelated entry-level roles, individuals in college working or pursuing towards degrees. So this is really just, again, saying that we're not looking for just one small demographic when it comes to potential wellness coaches. It's really anybody and everybody that has a strong interest and a desire to support our children and youth and to be able to support them in their mental health and well-being. Next slide. Another illustrative example, this is non-exhaustive, but this is just showing example sites for Certified Wellness Coach services. So again, they can be plugged in a wide variety of settings. Where we're really focusing right now is in our schools, which is that first category, or that first row, I should say, below the header. We, again, are connecting quite a bit with our public education systems to make sure that, again, there is opportunities for these coaches. There's a strong desire for them. What we're seeing is, a lot of these individuals already exist and are doing similar types of roles. So what we're trying to do is just expand upon that and really build that out into a statewide workforce. Community-based organizations is another one that we're really focusing on. Again, the primary focus is those that are school-linked and school-based, because that's kind of what we're focusing on in our employer support grant. But we are seeing, over the years that we want to roll this out across as many settings as possible, including health centers, government centers, telehealth. So we really see an opportunity for wellness coaches to be embedded into support teams for our children and youth, and really just wherever employers can see them as a value add, one more trusted individual, one more trusted adult that can really support our children and youth, ideally before there's crisis. Next slide. So I'm not going to go into this slide too much because Irene is going to do this in part 2. But now that you kind of have the understanding of what this role is, what are the services and competencies, what kind of education do they need? How is this identified? Why did we come up with these topics? And this was a slide that came about as part of our stakeholder engagement process back in 2022, which I can't believe I'm saying. And we had a wide variety of stakeholders across many different industries, including higher ed, including those that are in the field, clinicians, educators, those that really understand, okay, great. Now that you understand the services and competencies these individuals need, what do they need as a foundation to be able to meet those? So we have some kind of intro classes, and then we have some additional courses and topics that are listed there. And then, we just want you to see, okay, great. This didn't just come out of the blue. So we took this information and then we turned it into a form or a table, a template that you can then fill out to figure out what do you have on your campus in your programs that already align with this. Because we're not trying to reinvent the wheel. We thought originally maybe about doing a wellness coach degree and realized that takes years. And also there are a lot of programs that already very closely align with these type of topics. And it may be that they have all these things and we just need them to come up with, a specific program map for their students. Others may need to fill in some gaps that they don't currently have, and we have a mechanism and a structure for being able to go through that as well. So that is kind of the foundation that's going to get us into part 2. So if you can go to the next slide, I'm now going to hand it over to Irene Ornelas, who is our education consultant, who is going to talk through, okay, great. What do you need to do to identify your program's alignment with our HCI required courses and topics? And then what does it look like to actually become a designated program? So with that, I will pass it over to Irene. Just make sure you're off mute.
I just realized that. Good afternoon, everyone. My name is Irene Ornelas. I'll just give you a brief background and why I'm here. I was hired by HCI as a workforce consultant on this project. By profession, I'm a licensed clinical social worker. I worked in direct practice up until full-time till 2015, when I entered the world of CTE under the County Office of Ed, my local County Office of Ed, under the Career Technical Education Incentive Grant. In my experience with that, they hired me as a health industry liaison. And again, noticing that behavioral health, mental health was nowhere on the map as far as pathways in the high schools, and even in the connections with the community colleges that I had. I was then later recruited to work with the community colleges, specifically for be able to work in this space. And after our grant sunsetted in 2022, I've been providing consulting work in this topic in particular. It is a passion of mine because I see myself and the students that we're looking to have in this field. I was a volunteer case manager, first gen student, and worked my way through haphazardly becoming to licensure. So again, wanting to provide that clear pathway, streamlined pathway, hopefully, for the students that we'd like to see in these paraprofessional roles in the future. Next slide, please. So as you can see, Ben laid a really great foundation as to the why and how we came to this wellness coach, or how HCI came to wellness coach. And really, these are HCI's goals and the reason why it's important to partner with the community colleges. I'm sure you all, just by hearing the foundation and the objectives and the core competencies of the community of the wellness coaches, you can all see how the community colleges are a vital part to this, to getting this workforce up and running. So here are our goals, again, to provide students with basic science and foundation of social work and human services courses that prepare them to enter the workforce. California community colleges to provide students with advanced knowledge related to the behavioral health sciences that complements their interests in the field of social work, human service, addiction studies, or other related fields. So again, we all see our objectives like, okay, then how do we do this? It's the connecting with the community colleges to be able to prepare the workforce and get them ready to be certified wellness coaches. Next slide, please. Again, I won't dive too deeply into this slide because I know you all know your population of students. And again, this to me is why the community colleges are so vital in this partnership, because you all have those students that are reflective of the communities they're in, which in turn would be reflective to providers and providing those services in the communities that they are coming from. And again, those are the folks that we want to be providing these services, because we all know that they're able to understand the culture in their community, understand barriers, have their own personal experiences, And these are all very important. And again, this is why it's vital to connect with the community colleges, because these are the students that you work with on a daily basis. Next slide, please. So things to consider. The community colleges programs are interested in becoming designated programs are asked to assess their program's coursework and curriculum in these following areas. So again, to become a designated training or educational program, we're looking at programs that have transferable credits and stackable certificates, focus on workforce readiness and experiential learning, that the curriculum can be revised or aligned to meet the Wellness Coach 1 core competencies and a minimum course requirements, and prepare students to meet those core competencies and competencies and requirements so that they can become eligible for application to become certified wellness coaches. Next slide, please. Okay, so then again, in order to become a designated education program, we have designed a, as Ben stated, a table, a template, worksheet, if you will, to have you all review your courses, look at the topics and competencies that are required, and outline. We'll share with you the form shortly. Identify the resources that you may need in order to fill in the gaps so that you can then submit your application to become a designated education program. One of the things that I wanted to mention about that is that, again, as we move into the forms, these forms were backed into by the core competencies and requirements for the Wellness Coach 1 services that they will be providing. So you'll see there's quite a comprehensive list, but again, it is backfilled by those core competencies. Next slide, please. Okay, so this is Form 1. So this you can see is pretty basic information, wanting to know, the name of your program, what is the degree title, what are the certificates that you have in the program that are stackable into your degree, who the primary contacts are, so that we can connect with that individual, and then other statistics that we want to know about your current graduates in the program or your current participants. How much more could you take as far as in your program? Is there a cap as far as capacity? And what are your predictions, or what do you anticipate as far as graduates in the next 3 years? We want to know, how is it that your program is provided to the students, whether it be fully in person, online, or hybrid? And then why is it that you would like to become a designated program? Just wanting to know and understand your desire to then be part of this whole process, and in preparing our students to not only have, those foundational knowledge and understanding for the field, but really providing them with the opportunity to put theory to practice. I understand, and just from the overview that I've done of the various social work and addiction studies programs, there is, generally speaking, some form of seminar or field work that they're all doing, that your students are doing. And again, it perfectly aligns with being able to help them understand what they're learning in the classroom and, practice that in the field. Next slide, please. So as you can see, here are the list of, and I think Ben shared this earlier, with the core courses that we're asking folks to have in their program, with letting you know that, like, for example, let's say you currently don't have a child and adolescent development program or course in your program, and that's something that needs to be either created or borrowed from a different program. This is not to say that you would not be provided the designation, but we may provide you with a conditional designation until those gaps are met. So again, this is not to mean like if you don't have all these competencies and requirements currently in your program, but it's really to identify and have you understand what we're looking for, align it to your curriculum, your current program, and identify those gaps so that, again, we can help you, support you, and how to like close those gaps for your program. You can see that here we'd like to, as far as the course title, the course outline, preferably we'd like to have you add links here for us that we can access to review the course outlines, and then identifying course objectives. And this, outside of those core courses, these topics can be met by supplemental trainings. It could be met by another, like this topic may be able to be met within those 4 course requirements. So it's okay to duplicate a course within that meets those requirements. So just wanting to be clear on that. Next slide, please. So once you've gone through and identified the courses, the core competencies that we're looking for, this will then now provide you with a full picture to identify where the curriculum gaps are. And so this would be a place on the form for you to all tell us, here's what we see our gaps are. This is where we think we have room for improvement, or this is where we'd like to be as a program. Next slide, please. And utilizing that information to then tell us what is it that you need in order to meet that gap. So for example, do you need a counselor to help with working with the students? Do you need somebody to market the program? Anything down to like coursework development, providing additional training for your students, anything that you all considered that you would need in order to resolve these gaps. And then we're asking you to let us know, how much do you think you might need in order to get this work started, to support what you're doing as far as funding. So then that will then be submitted. Next slide, please. Oh, never mind. So that will all be submitted to HCI, and we will then review all that information, everything that's been sent to us, and then reconnect with you all. We will then send out a separate form that basically states you've been approved as a designated education program with dates, because we will put in a review date for programs to come in a review, much like maybe perhaps one of your BRN or other accredited programs. We're really looking at this designation as sort of a formal accreditation. And so then you'll receive that form, and you'll know at that point, whether you've been approved as a designated program or conditionally approved based on any gaps that need to be met. Now, next slide. So I'm going to hand it back over to Ben to talk to us about facilitate a conversation about any questions and answers you might need. Thank you.
Yeah, of course, Irene. Feel free to pop on and off as you would want, or if you want to stay on camera, because I'm sure it'll be to both of us. But we just went through a lot of information, and now we would love to welcome questions, because I'm sure there are several. This is a rather small group. So if you just want to raise your hand, we're happy to call on you, or if you want to throw your questions in the chat, you can do that as well. So we definitely welcome people to start letting us know what they need clarity around. All right, so the very first, oops, I just got rid of all of my people. I think the first one I see is Maria.
Hi, everybody. I'm here in lieu of our director for our addiction studies program at East Los Angeles College. And I just wanted to be sure that we're going to be getting this information maybe sent to my email, so I could, send it on to the other people that are also involved.
Yeah, and we are going to be turning this into or making this deck available, as well as following up with the forms that Irene screenshotted, as well as the guide that just really gives even more information. I believe we said within 7 to 10 business days, but we'll try and get it to you even sooner than that if possible. But yeah, we're going to follow up with a full packet, and we'll make sure to send that out to this entire group of attendants here as well. So you can pass it up the chain to whomever you feel needs to see this to be able to move forward. And the goal ideally is that this gives you enough information that you can start to work through it yourselves. However, if you do need additional one-on-one conversations, we are here to provide support. Irene would be your main point of contact, and then I am, of course, here to jump in as needed. But we by no means intend individuals to just have to figure this all out on their own. We are absolutely here to support and guide our potential partners with going through this process and making sure they have all the information they need.
And I neglected to mention that there will be a guide that is will basically serve as a step-by-step. It'll allow you to have the information as far as why this was started, specific information for the colleges. It'll have the code of ethics for the wellness coaches. So it'll really give you a really good context for what this is all about. And basically a step-by-step to go along with the forms that you saw earlier.
Yes, thank you. And I see Anne just kind of put a question in the chat just about that as well. Those are the resources that'll be available. And we can also follow up. And I actually don't know if we have our resource link, but what we can throw in here as well is perfect. We have our website here that gives a lot of information. That's the California Wellness Coach. That's kind of more of our public-facing website, but there's a lot of great information for employers, for potential applicants, as well as for our HCI designated programs, for those that are interested in becoming HCI designated. And then the HCI website you see linked down there as well. That has lots of additional resources and information about our grant, about our model of the Wellness Coach itself. So plenty of documents if you need to educate yourselves around the profession or just find some more information to ensure that you've got everything you need to be able to start working through this process. Any other questions? Samantha. You're on mute, Samantha. Still on mute. I might be able to unmute you. Oh, no, I can't.
Sorry. There we go. Sorry about that. I said
welcome,
hi.
Samantha. Hi.
Hi. So I'm with Fresno City College. I am currently interimly fulfilling a Perkins role for the social science division. I had a couple of questions. One being, when you were reviewing the behavioral health career lattice, I know there's a certified wellness coach too. Is there any particular bachelor's degree program that you would be looking for those positions?
Yeah, we're currently aligning with our CSU programs to be able to build those out, and very closely with our bachelor's of social work.
Okay.
Social work tends to be a really, big aspect to that. Really closely aligns. So right now we're doing that, and a lot of that too is to try and really support that upward mobility and transferability. And, of course, having the BSW allows them to be able to move up into a master's level and above if they do decide they want to go that clinical route. So that's kind of our primary focus with that Wellness Coach 2 bachelor's level education program.
Because my concern would be is that we've tailored this program so much to do the wellness coach job that it rules out getting them to a CSU in a timely manner for a program that's available for them. That would be one of my concerns. And then
can you I want to make sure I'm clear on that. Can you expand
Right.
on that? And Irene, you maybe have some thoughts.
So, Fresno State is our local feeder, or our local or CSU. They do have a social work program. Other than that, they have lots of social science degrees, obviously, like other CSU, psychology, sociology, and just wondering how much of this coursework you would like to see, and making sure that we are developing a program that can be completed in 60 units so that our students aren't being I don't want to say set back, but for lack of better words, just being held back here longer than they need to be, and being able to move on in case they do want to have that upward mobility in the profession, and just trying to find something that aligns very well with the CSUs and not just necessarily the things that you're looking for the health wellness coach.
Right. So really, I think Ben stated this earlier, the idea is not to have you create a completely different program. It's really to align your existing program, or even I know some community colleges, it may be a matter of like, oh, here's your course options, your electives for, choose from these A and B. And it may be the counselor that may sit down with that student and say, hey, you've taken all these classes, you may be eligible to then become a certified wellness coach at the state. So, just guiding them in that respect. Like if you'd like to do that, you may need to add, choose adolescent development versus abnormal psych or something like that. So it's really not wanting to limit them. And again, the point is to have it stackable into those CSU programs. At this point, it is aligned with the social work or the BSW program. Again, so that we can mitigate, having students, at associate's level far too long, hoping to minimize the credits as much as possible, but again, not to add an additional barrier, but really to stack into and provide a seamless, as much as possible, transition from associates to bachelor's and then master's level.
Got it.
And I'll expand on that a little bit too, in that, with all those, that like long list of courses and topics, and I think Irene probably touched on this as well, is that there might be one course that covers 7 of those different topics based on how it's structured. They could, touch on documentation basics and coaching counseling frameworks and reflective practices. And it could be that there's one course that covers quite a few of those things. Or if it doesn't, it might just be that the syllabus needs to be restructured a little bit to focus on that topic during that particular course, or potentially in addition of a seminar. So we're trying to be pretty flexible and really working to individualize what works best for what the programs currently offer. And at the end of the day, it's all about, do these students come out meeting these competencies? Have they gone through and met this training? And do we feel secure knowing that once they complete their degree program and their required hours, that they're workforce ready? So it's definitely meant to be a little bit of an iterative process, and especially because we understand at the community colleges that there's not universal curriculum and standards across the board. So especially with our community colleges, we definitely would love to figure out what works best for you and kind of align accordingly.
Which I think maybe you answered my question, but my next question was going to be, under the additional topics, if there was objectives with those attached to those that we can look further into. For example, you have communication. Is there a particular form of communication that you're looking for? Because our colleges offer several different communications, but I believe, and if I'm reading you correctly, that I guess I'm kind of looking at these additional topics as more of competencies rather than courses. Is that what you would? So, okay.
Well, if you look at when you get the form, you'll see there'll be asterisks on those additional topics, or it'll guide you to where the core competencies are for the wellness coaches. Okay. So they're directly aligned. So you'll see in parentheses, it may say 2B, and you'll go look at because you'll have a list of all those services and core competencies of the wellness coaches, and you'll be able to go directly to see what the objectives are for those wellness coaches.
Find that, because I actually was cleaning my desk today and found this the training program requirements that my boss sent me, I don't know, March 17th, a long time ago. So,
that's probably a very early iteration when we were initially talking. There's been a lot of development. We're just now in the process of finalizing all that. And that's what I was mentioning in that previous one, that we're packaging all that up and ideally sending that out within about a week to everybody on here. So you'll have all that information. That one is maybe just like a template you can use to start, getting your brain oriented around it, but that is not the comprehensive information. So
perfect.
Glad you have it, but please don't think that's all you'll be getting.
Okay, perfect. That wraps up my questions for me. Thank you so much.
Of course, yeah. Next one, I think I see Sang.
Yeah, hi everybody. We're really excited about this, and I know Ben, you and I talked, I think like maybe a year and a half ago or something.
It's been some time. Yes, nice to see you.
Yeah, a couple of things. 60 units, are those quarter units or semester units? Because I know some of our schools are, you know, based on quarter and some are semester.
Yeah, you know, it's really intended to be what is equivalent to completing your associate's degree. Yeah, and Irene, if you have anything to expand upon that, but where we're just really looking, that was an original, it was going to be very clearly delineated into 52 for this and 8 for this, and then we simplified it essentially as long as they've completed the requirements to get their associates.
And, you know,
It's really the associate's degree.
Okay, got it. Many of our students are dual enrolled, you know, even here at Ohlone, some of our students take classes at Las Positas and at Chabot. We have 7 community colleges in Alameda County, and I see a colleague that I will meet soon, Megan, who's on here, so that's wonderful. But can students draw from multiple campuses? You know, because I know for example, like one of my students who I met with yesterday, she takes classes here at Ohlone, but her primary camp is at LPC. And even though she's getting, you know, 2 associate degrees, for her UC application, she was only able to list 1, the primary one. And so I know that that's happening. And so I just wanted to know, like, because I feel like we are probably short on some of those classes at Ohlone, but we are really, we have the infrastructure set up to support students in the 400-hour practicum. So we want to like play that role. And also maybe we have a few classes that maybe Chabot may not have, or Berkeley City College or what have you. And so, you know, is that a possibility? Because, you know, at Ohlone, we operate our countywide mental health navigator program, which is a workforce development program. And you know what I mean? So I feel like as a county and as a network of community colleges, we're already working together to some extent. And this would really be a boost, not only for developing the pipeline, but really boost enrollment, right, at our schools, which is something that I'm sure all administrators would just love to support.
I have a thought, but Irene, if you want to start. Yeah.
Sure. I think one thing is the idea of having a designated education program is that we all know, and it's been blessed, and whatever students are graduating from that program met the requirements, right? But I know that, like you said, you work together. So I think I'm seeing it as like, okay, so let's say the student graduates from Ohlone, but they have transferable credits. As long as they've met those courses, even if it's among a collaboration or agreement within your community college system, your district, I think we're looking for the students to come from that designated program, met those requirements, whether some of the courses they took at a different college, as long as it's transferable and they're meeting your degree requirements. I think that's the key piece. If multiple colleges want to become designated programs, it's really up to you all at each individual college.
Yeah, because and we can take this offline, but I just want to say something really quick because I see Megan on the call. Like, I could see where I get together with the Chabot Las Positas district, because we're South County for Alameda County, and we figure out, okay, who has what, right? Okay, we have 3 of these, you guys have 4 of these, and we can kind of figure out, and apply for designation. But then on our websites also say, if you live in the Southern Alameda County and want to go for this, you may have to do a piecemeal, but know that among our campuses, there is an infrastructure set up for you to be able to meet, the requirements to be able to get your, get your coaching certificate. Yeah. Okay. Thanks.
Yeah. And I'll just expand, I think, on what Irene was saying, that if there needs to be one campus that owns the designation, as long as they're signing off and again, ensuring that all of those pieces are met and that they're completing their associates. And again, there's that transferable aspect. See no issue with that if it's kind of almost like in a consortium or a group that's applying. We just would want to make sure that there's clear documentation or understanding of what that relationship is. But if all of them want to do that, I think that's fine. I know part of what we're also curious is, are there online offerings? Is it a hybrid model? How would your students succeed? The only concern that I would have, and I don't even know enough about the structure yet, is that it's not overly complex, that students would have a difficult time navigating how to complete the program and meet the needs. Because again, when we're thinking through that representative aspect, we really want to recruit as much as we can, but also ensure that there's enough clarity and resources available to be able to walk your students through what the requirements are. And we've talked, Irene, I don't know how much we went into it, but we are also providing funding to fill in some of these resource needs, to really ensure that if it's an additional seminar that's needed, if it's faculty hours that are needed, whatever it can be, that we're providing some component. Of course, we don't have non-exhaustive funds, but we want to, try and do what we can to reduce the burden on our programs as well. So that is part of this. I know you mentioned that briefly in the forum about the resource request, but just wanted to call that out one more time as well. Perfect. Tanya, I see another hand.
Good afternoon. Thank you.
Hi.
You just answered one of my questions, and that was about the funding, because I did see something about funding being available for the colleges, and so I'll take that one off the list.
Great.
Is there any type of plans? Are there any plans on bridging the gap between the CHW as well as those who are maybe in the peer support and being able to come over to the programs? Like, they might be taking some programs that's not within a community college setting. They may have taken those programs within some of the community organizations, and some of those organizations may have even gotten quote unquote HCI designation for those programs. Is there any way to bridge the gap for those folks who've done that and maybe working in the field, or not even working in the field, but want to continue on into the community college setting to continue their education, to expand their education, to where they don't have to start all over? Is there opportunities, or have you guys thought about credit for prior learning? Any type of opportunities like that we can easily bridge students from other programs and other training that they've had over into the for credit side with the community colleges?
Yeah, great
Right.
question, and something that we've talked about in quite a bit. And I think it really does come down to, at this point, and not to say that this won't be developed in the future, but it would be, are those transferable? Can they be transferable to the community college in terms of credit? Can that apply towards the associate's degree? And then also looking at their work experience. We do have rather extensive work experience, and we can talk more about what is required in individual conversations. But if they do have experience working with children and youth in a behavioral health capacity, that those hours could directly apply towards those certification requirements, so that they have less of a burden there. So that would be kind of the initial thought, is really trying to focus on what their experiential aspect is. In terms of the credit for prior learning, that's something at this point that we have not developed out. So as it currently stands, it does have to be transferable into the community college to apply.
Okay.
And I think the credit for prior learning really sits with each institution about what you all, so if somebody has gone through peer training, the 80-hour training, then what are you all at your institution willing to accept as far as credit for prior learning that may be an equivalent to one of the courses that meets the requirements? So then that would be each institution to then say, okay, we're going to give you credit for this course or the training that you've already received because it meets all our course requirements. So I think that's where that's going to have to live. But I totally hear where you're coming from. And I think it may be one of those kind of like separate conversations that educators need to come together and talk about, like, how can we do that so that those trainings are invaluable, and we know that, there are folks that are with lived experience, and how can we give them credit for what they've already done and not making them have to start all over and discouraging them, right, from getting into the program.
Yeah, and part of, HCI's balancing act, for lack of a better term, is really focusing on kind of what Irene was pointing to, that local control aspect, really not going in and kind of mandating what can be accepted versus not, because it really does come down to each individual institution and, what's happening within their region. So however we can support those conversations, we absolutely will do, but it really does come down to what are the relationships and the agreements that are occurring locally.
Okay, yeah, and I asked because if that was something we were deciding to include within our program, I just wanted to know if that's something that would be accepted in terms of the designation before we even start having those conversations.
Great, thank you for the question.
Thank you. Let's see, and I think kind of sort of got an answer to this one. You guys mentioned supplemental trainings. What exactly, because supplemental trainings can be just about anything. What exactly are you looking along the lines of what supplemental trainings can be in terms of at the community college level?
It can be, with a community partner, community industry partner, for example. Maybe they're providing that trauma responsive care. They have a workshop on that, and that can be met that way. It can be a training that you all host on your campus, again, or one of your industry partners has, that they're expert in. And we're looking for you all to say, hey, again, that's why we're asking to provide those objectives and a link to the outline, so that we trust that you all know whether it's been met or not. We're leaning on your expertise. And so again, those goals or the topics are then aligned to the core competencies. So we're really leaving it up to the community college discretion to see, okay, what is it that we think have met those topics and core competencies.
Thank you.
I hope
That's
that
all the
answered your
questions that
question.
I have. Yeah,
Great.
Thank you.
Thanks, Tanya. Kelsey.
Hi. Okay, thank you. So 2 questions. One is this just set up for social work programs primarily? So I run a health coaching certificate program at Mesa College in San Diego, and we're thinking about developing a public health sciences associates on top of that. And so these courses don't totally align with public health, but there's a good amount of overlap. So I'm thinking we might be able to create like a pathway, like you were saying, that might lead towards this. So I'm just wondering, like, is this totally designated or designed around social work, or are there other areas or fields that you're looking for these associates in?
Yeah, great question. Our initial kind of immediate targets have been social work, addiction studies, and human services programs.
Okay.
That means a lot. Human services can be named a variety of different things. The reason we did that is just through Irene's work, and then just some of our, kind of crosswalk analysis, that there seems to be a pretty strong alignment with our courses and topics with those programs. So it's less of a lift. We have the ability to, ideally reach more individuals and get it out faster by aligning with those programs. But if there seems to be a strong alignment with something that you already have, we absolutely want to have those conversations, figure out what is the gap, if any, how closely do those courses match. So I think we'd really encourage, a follow-up conversation, or as you start going through the process, we can figure out, okay, great, like what is the timeline for this? What is the capabilities in moving forward? So that's kind of our primary target, is really focusing on those 3 degree programs. But if there's some that's kind of in that gray area, then let's set up a conversation to go through that.
Awesome. Okay.
And I'll add that part of the other reason is the whole goal is to grow the behavioral health workforce, right? There's a need for more clinicians. So again, as been stated, that program is more likely to then transfer to a CSU and a bachelor's in social work, or other programs that are aligned for them to go on to graduate schools to then become clinicians. So this new role, this new designation, is really entry point, a bridge to become then ultimately the clinicians that we need in the workforce.
Okay.
And this role also is supporting those clinicians, supporting those folks at graduate level, in order for them also to hopefully receive some mentorship, be inspired to continue in their education. This is all part of a response to the governor's budget, and saying, hey, we need more mental health workers in our communities, as well as the California Department of Education, their call to action to fill up to 10,000 new mental health workers in their schools. And that's why, like Ben said initially, the focus is on those programs. But again, it's not to say that, other programs may not be, could be eligible. It's just the low hanging fruit at this point in time. That makes sense.
That makes sense. Yep. Thank you. My second question is about the supervised hours, the 400 supervised hours. Are folks supposed to be doing that in alignment with the community colleges, like through the college? Are we supposed to set up those liaisons, or are there opportunities for them to do that after the fact, then before they sit for certification?
Yeah, great question. We do understand 400 is quite extensive. In part of the guide and program, and just to get clarity real quick on the background, that was part of our stakeholder engagement process. We can go into the big details around that, but essentially that was designed before we started really having conversations and diving into what does implementation look like. And so we do understand that's a heavy lift. So what we've done is actually lowered that in the degree programs. We're looking for a minimum of 150 hours for them to complete as part of their field experience. And then they can get the remainder, 250 hours once they're actually on the job.
Okay.
So it's really 150, but there is just a high priority, and really to underscore that we are looking for that experiential training as part of their degree program. We really want to ensure that they understand what it's actually like to work with constituents, that they understand what it's like to be observed and supervised while working in a behavioral health capacity with children and youth. So hopefully that addresses that question.
Yes. One follow-up to that is, are those 150 hours, should they be integrated into coursework in the school? I guess what I'm saying, like, should there be courses where we're supervising their connections, or is it like, okay, you've completed your coursework with the school, now here are some partner organizations that you can work with to get those clinical hours?
Ideally and that's kind of why we did most of our alignment with social work, addiction studies, human services, is because they already have like practicum internships embedded into their degree program. So the intention is that this is meant to be ideally part of the degree program, so they're not having to go do extra work, unpaid work. So wherever we can embed it as part of the degree program is absolutely the preference. I think we are also very curious to see, like, what are other solutions and opportunities out there? What type of relationships are there? Long term, this is not part of this discussion, but we are also looking into building out apprenticeships in the future. Just to kind of think about what are some long-term sustainable mechanisms and ensuring that we can get that workforce training and ideally support our people with paid experience. But that's something that'll be developed in the coming years.
Sure. Okay. Thank you.
The other piece, students can use, like, let's say they're doing volunteer hours on their own. It's just a matter of, I think the school, like, saying, okay, if you've done X amount of volunteer hours, we need like some sort of documentation that that's been done, and what was it that you were doing while you were volunteering, again, so that can be counted towards their 150. So it's not to say you're going to get all your 150 hours in your field seminar or practicum, but there are other opportunities to count the hours that they're doing in other, in their own service work.
Got it. Okay. Makes sense. Thank you.
Sure. Any other questions? I know we still have, I think, another 20 or so minutes. So if there's any last minute questions, we're happy to stay on. Also happy to give people time back if that was, nothing else burning. And then, of course, you've got our contact information there. Irene, I don't know if we were going to put in your email. I don't want to say anything yet, but if you have any questions, you can reach out to our wellness coach inbox, and then we can kind of vet it out from there, or pass it along from there. But please reach out if there's anything else that you need. And then we will follow up to this group that attended, again, with those resources, including the deck, the guide, the associated forms, and then, of course, in this deck, there are links as well as additional resources that can be found. So hopefully you'll have all the information that you need to really move forward. And in that follow-up, we can also provide Irene's direct contact so that if you need to set up more time to chat through this process, have any type of technical assistance, you have that resource available. So I think with that, we just want to thank everyone so much for coming today, for your really thoughtful and wonderful questions. And we're really excited about the potential of collaborating and partnering with you to build out these HCI designated programs. So thank you, everyone.
Thank you. Have a good rest of your day.